I think it's changed dramatically over the last 20 years. Opiate overdoses were far and few between when I first came on the job, and now they're fairly regular.
Anyone can suffer an opioid overdose. There is good news, though. Overdoses, which are life-threatening, can be reversed with a medication called Nalaxone, also known as Narcan. Nasal Narcan is sprayed into a person's nose, and it's easy to use. In this video, we'll tell you exactly what Narcan is and how it works, as well as help you identify those who could be at risk of an opioid overdose, signs of an overdose, how to respond, and how to use nasal Narcan, as well as other additional information about this life-saving medication.
I think it is important for people to understand the risk factors, why that person in their life might be at risk for an overdose.
Anyone that has any time of abstinence or sobriety, so jail time, hospital time, even abstinence-based recovery time.
If somebody has a pre-existing kidney, liver, heart, or respiratory condition, those can all play into it as well. If somebody is mixing, for instance, if I take a benzodiazepine for anxiety and I break my arm and the doctor prescribes me Oxycontin, that combination could kill me.
I think that none of us wants to acknowledge the fact that our loved one may be using opiates. It's a hard thing to put in your head, and so why would you want to look for it if you didn't want it to be there? You know, I think that's part of a problem too.
Just knowing the basic risk factors of what can cause an overdose is really important to understanding why and how it can happen.
Being able to identify someone that is suspected to be suffering from an overdose, knowing what that looks like, signs and symptoms.
You're going to have somebody that isn't going to respond to touch or a noise stimulus.
You want to look for blue lips and blue fingertips, cold, clammy skin, gurgling or slow breathing.
Check their pupils if they're pinpoints, usually like almost no pupil visible.
Well, those are all indications that someone is likely, someone has likely overdosed. And then having some options to be able to treat it.
So Narcan, or Naloxone, which is the drug's name, is an opiate antagonist. So it knocks the opiates off the receptors in your brain that would otherwise be taking on the opiates that are in the bloodstream.
It doesn't get rid of the opiate. The opiate's still circulating in your blood. It's just not able to affect you.
So it doesn't flush the opioids out of the system, it just blocks them temporarily and allows the person to start breathing and allows for further medical attention.
Naloxone has no side effects beyond saving somebody's life. It has no risks associated with it. All it does is reverse an overdose.
The administration of nasal Narcan to a suspected overdose patient is actually quite a simple process. What you first want to do is identify that the victim is, in fact, unconscious. What I prefer is what we call a sternal rub, and this would be just taking your fist and rubbing your fingers across the breastbone of the patient. You want to provide some discomfort so that if they are just asleep, you are waking them up. Once you've determined that the person is unresponsive, immediately, whether you do it yourself or if there's somebody else around, 911 must be activated. Now would be the time to administer the nasal Narcan. To open the Narcan is a very simple process. Simply pull the back aluminum off of the packaging, reach in. All you do is place the tip into one of the nostrils of the patient and depress the plunger firmly. Very important that you don't test it prior to administering into the nose. That will break the seal and you will then not get the full dose into the patient. At this point, you do want to check for breathing. You may want to put a hand on the chest and feel for chest rise. You may want to put your face down close to theirs. You could feel them breathing. If there's no breathing, you would check for a pulse at this time just to make sure that CPR is not needed. If you're not trained for it, wait for help. This is where you want to take them and roll them up onto their side so that if they do vomit, there won't be any airway compromise. You can spread the legs. And then stay in place until 911 arrives.
You've just learned that anyone can rescue someone going through an opioid overdose by using nasal Narcan. But how can you help prevent an overdose in the first place? If anyone is prescribed an opioid pain medication, it's important to know the side effects, signs of opioid dependence, and to follow the directions for the medication exactly as written, and only for the length of time prescribed. To be sure you always have nasal Narcan on hand when you need it, it's important to follow the storage instructions. Understand it is sensitive to extreme temperatures, and it has an expiration date. Finally, if you or anyone begin to feel dependent on opioid medications, help is available by calling 211 toll-free.
We certainly see every level of socioeconomic standing being affected by this, for sure.
Overdoses can happen at any time and can happen to anybody.
They're doing the best they can, so they're not bad people, but they need help.
The solution is to support each other, and the answer is you can do that with Narcan.
Doesn't it feel good to know you can save a life? Make the healthy choice. Be informed.